Good, how are you?
When I started my medical career in medical school, I thought I was actually going to go into geriatrics. But I fell in love with pediatrics, and then 6 months into my very first faculty position, and my own daughter was diagnosed with leukemia. That is a different perspective on what happens, and it certainly, I'm sure, affected the way that I see my patients and treat my patients. And I have that happy ending that I want for all of my patients, because my daughter now is an adult and doing great, and that's what I want to see for all of our patients. And one of the really neat things about hematology oncology, well, there's actually two. One is that you really establish relationships with patients and families because your relationship is very long term. And the second thing is there's always something new to learn and something new to try, and so it really keeps you hopping. Family-centered care is, again, very important to what we do, maybe more so than any other aspect of pediatrics, because the treatments we're giving are so complex and they affect every aspect of the child's development and life that we may know lots about cancer and we may know lots about chemotherapy, but we don't know lots about that particular child. So the parents have to be part of our team, and they're the ones who know something's just not right today. And so I think we take much better care of the patients by having the family as part of the team taking care of them. And I think it's very, very complicated to decide where your child's going to be treated. But what I see and talk to from many of our patients who come here from other centers and from other countries is that family-centered care and that willingness to really work together and bring everybody in to try and make the right decisions and the right care for the patient. And that is something that's really very unique to Nemours. We always approach every patient with how we're going to cure this child and how we're going to make sure this child grows up healthy. Every time I get an announcement of a college graduation or hear from a patient who has their own family now, those are the real rewards of what we do.